Hi everyone, and thank you for being here. Today, we're talking about something that touches millions of families around the world: dementia. This is a topic that can feel scary. It can feel overwhelming, and sometimes it's something people avoid talking about altogether. But awareness is powerful. The more we understand dementia, the better prepared we are, whether it's for ourselves, our parents, our grandparents, or someone we love. Before we go any further, I want to share something important. This video is for awareness and educational purposes only. It's not meant to diagnose or replace professional medical advice. If you or someone you care about is experiencing memory loss or noticeable changes in thinking or behavior, please speak with a qualified healthcare professional. Only a medical provider can properly evaluate and diagnose what's happening. Okay, let's talk about what dementia really is. First, dementia is not a single disease. It's a term used to describe a decline in memory and thinking skills that is serious enough to interfere with daily life. The most common cause of dementia is Alzheimer's disease, but there are other types too, like vascular dementia, Lewy body dementia, and frontotemporal dementia. Each type affects the brain differently, which means symptoms can vary from person to person. Now here's something very important. Dementia is not a normal part of aging. Yes, as we age, we might occasionally forget where we put our keys. But remembering later is normal. Forgetting repeatedly, getting lost in familiar places, struggling with daily tasks, that's different. So let's walk through the 10 early signs you should know. 1. Memory loss that disrupts daily life. This is usually the first thing people notice. Forgetting recently learned information, repeating the same questions over and over, relying heavily on notes or family members to remember things. It's not just occasional forgetfulness. It starts to affect everyday life. 2. Difficulty planning or solving problems. Something that used to be simple suddenly feels complicated. Following a recipe, paying bills, managing monthly expenses. You might notice it takes much longer to complete tasks, or they stop doing them altogether. 3. Difficulty completing familiar tasks. Driving to a place they've been going to for years. Playing a favorite card game. Cooking a meal they've made hundreds of times. When routine tasks become confusing, it can be a warning sign. 4. Confusion with time or place. Losing track of dates, forgetting what season it is, getting disoriented in familiar locations. Sometimes they may not understand how they got somewhere. This can be very frightening for the person experiencing it. 5. Trouble finding words. You might notice they stop mid-sentence or struggle to find simple words. They might call things by the wrong name, like calling a watch a hand clock. Conversations can become frustrating for both sides. 7. Misplacing things. Putting keys in the refrigerator, leaving a phone in unusual places, and then being unable to retrace their steps. Sometimes this leads to accusations, believing someone has stolen from them. This can create tension in families, but it's important to remember, it's the disease. Speaking. 7. Poor judgment. You might see unusual financial decisions, giving away large amounts of money, falling for scams, or neglecting personal hygiene. This isn't just a bad decision, it's a noticeable change in judgment. 8. Withdrawing from social activities. Someone who used to be social may begin avoiding gatherings. They may stop participating in hobbies. They may sit quietly in conversations. Sometimes this happens because they're aware something isn't right, and they feel embarrassed. 9. Changes in mood or personality. This one can be especially hard. A calm person may become irritable. A confident person may become anxious or fearful. Depression, suspicion, mood swings, all can appear. These changes can happen even before memory loss becomes obvious. 10. Changes in vision and spatial awareness. Trouble judging distance, difficulty reading, problems recognizing objects. This increases the risk of falls or accidents. Dementia happens when brain cells become damaged and can't communicate properly. Depending on the type, it might be caused by protein buildup, reduced blood flow, or degeneration of brain tissue. Sometimes, and this is important, other medical conditions like vitamin deficiencies or thyroid issues can cause dementia-like symptoms. That's why medical evaluation matters so much. The biggest risk factor is age. But there are others: high blood pressure, diabetes, smoking, head injuries, lack of exercise, social isolation. The encouraging part: some of these are within our control. Staying physically active, eating a balanced diet, challenging your brain, staying socially connected. Brain health is lifelong health. If you suspect dementia in someone you love, encourage a medical appointment gently. Avoid arguing if they're confused. Create simple routines. Label drawers and rooms if needed. Make the home safer. And most importantly, be patient. Caregiving is not easy. If you are a caregiver, please hear this. Your health matters too. You cannot pour from an empty cup. If memory loss begins interfering with daily life, if personality changes feel drastic, if confusion becomes frequent, please seek medical advice. Early diagnosis allows access to treatments, planning, and support. Dementia is more than memory loss. It affects identity, independence, relationships. But awareness changes everything. The earlier we recognize signs, the earlier we can respond with care, compassion, and preparation. And again, this video is for awareness only. If you have concerns, please consult a qualified healthcare provider. If this video helped you, share it. You never know who might need this information today. And if you're walking this journey with someone you love, you are not alone. Take care of your brain. Take care of your loved ones. And take care of yourself. Thank you for being here.